something I'll be doing to keep you up to date with all of the key issues in the Trust, and I hope you will find it to be informative. The first item I wanted to update you on was the financial position, and I'm really pleased to be able to say that we met our financial plan in 2012-13, giving us £2.6 million surplus. Now that's not profit that we somehow put in the bank, it's about actually allowing us to deliver those patient developments and service changes that we know are important to the continued improvement within the organisation. In terms of the challenges, it's been a huge year of challenge, and I have to thank the staff for the tremendous work that they've been doing there. This year is going to be no less of a challenge, and we need to continue to drive the transformational changes and the efficiencies that we know are the right thing to do. I'm pleased to be able to say that we've made our contract agreement with Tameside and Glossop Clinical Commissioning Group and the Council, and we're in the final stages of doing so with Stockport Clinical Commissioning Group. We continue to face huge challenges with the accident and emergency 4-hour standard. And as you've heard before from our previous communications, we were found in significant breach by Monitor in not achieving that standard. That's now changed into something called an enforcement action. It doesn't mean that Monitor have any different or more concerns about us, it's just a new way of working for Monitor. We're doing everything possible to ensure that we can come off that enforcement action and make the changes to ensure that at least 95% of our patients do receive their care and either are treated or discharged within that 4-hour period. There's a major transformation programme taking place on that, and the whole of the organisation is focused on that. One of the key areas that we're looking at is to increase our medical staff capacity, and we're looking to recruit up to 12 consultants in accident emergency and up to 7 in the acute physicians. I think this will make a tremendous difference to having really senior decision making by the medics at the front door. Given the poor performance in accident and emergency, it's really important that we remember that there's over 30 different standards that we're having to meet as an organisation, and we're compliant with all of those. One of the most challenging of those has been around infection prevention, and the MRSA and C. difficile targets were met during the year, but not without a huge amount of improvement work, led very much by the infection prevention team, but delivered by every one of our staff. We're going to be close approaching 500 days without an MRSA hospital-acquired infection within this organisation, which is a huge issue to celebrate. The annual inpatient survey was published in April, and we came out about the same. Now, whilst that's not a bad place to be, it's not something that we're particularly celebrating, because we want to be better than we have been before and better than other organisations. In terms of the questions, we actually fared better in one of the questions, worse in 2, and the same in the others. And what we've done is we've put together a really detailed action plan so that every one of our staff understands those things that are going to make a difference to our patients. And so we look forward to making those changes and having an improved patient survey result next year. In terms of patient feedback, one of the new areas that we're looking to is the Friends and Family Test, which was introduced nationally on the 1st of April and is now in every one of our clinical departments and wards. The key question that's being asked is whether, having had care within this hospital, the patient would recommend that care in this hospital to their friends and family. We've already had some pilot areas looking at this, and the results to date have been good. It will allow every one of our departments and wards to have individual feedback as to what patients think about their own services, so that they can immediately put right any areas of concern and continue to work on those areas that are well delivered. In terms of inpatient feedback, it's really important to actually take that feedback as close as possible to the delivery of service. And so I'm pleased with the national initiative of Friends and Family Test. This was implemented in the majority of our wards and departments from the 1st of April, Maternity coming later in the year. And that allows us to ask a question to people who have received care to say, would you recommend this organisation for care to your friends and family? We'll then be able to publish those, the first being in July, but we'll also give feedback to the individual wards and departments to allow them to understand those things that were appreciated by patients and those things that need to be improved. Regarding maternity, I was really pleased to be able to go up there the other day and see the start of the refurbishment of the maternity ward, where we've had half of the ward, 10 beds, newly refurbished. It's marvellous to be able to look at the old and the new, and I know that the mums-to-be will really appreciate the service changes. We were lucky enough to be given £450,000 by the Department of Health to undertake this refurbishment, the highest amount awarded within Greater Manchester. And we look forward to phase 2 of this development, which will involve birthing rooms, induction rooms and the rest of the wards. We're going to have a brand new look website launched in the next few weeks, and I hope that that allows you to be able to look at the things that are happening within the Trust. It's been developed very much by our own in-house communications team with support by the information technology team, and that's allowed us to do it at little or no cost. I'd very much ask you to look at this website, particularly the new performance section, which will give you up-to-date information on how we're doing in terms of the various standards we're required to meet. We're getting ready to hold our governor elections in 4 of our constituencies: Bramall and Cheadle, Marple and Stepping Hill, Tame Valley and Werneth, and Tameside and Glossop. Anybody who is either interested in being a governor or knows somebody who you think might be interested, can you please advise them that they can register from the 29th of May and voting will take place in June. This is an opportunity to get involved as local people in the running of the organisation. And I ask you to think about it seriously. We really do need people to be involved in the running of the Trust to make sure that Stockport NHS Foundation Trust does meet the requirements of the local public. And finally, I'm delighted to be able to tell you about some awards that we've been winning. I can't cover them all because there are so many, but the prestigious ones I particularly like to mention and commend is, first of all, the first NHS trust in the country to be awarded the ISO accreditation for emergency planning. We were highly commended for the Sustainable Business of the Year award, something that is not a public sector but is a whole sector award, and we were beaten only by Marks and Spencer's. And finally, a huge success with Anne Hudson, who's one of our Stockport district nurses, who's been shortlisted no less than the Queen's Nursing Institute Award for Excellence. Well done to everybody and to all those other people who have been given awards recently. I hope that you've enjoyed that podcast. I look forward to giving you the key issues from next month, and I'd ask you to be very much part of the organisation and feedback, both those good things and bad things. We need to hear from you, your messages, so we can continue to improve. Thank you.